Shelter Behavior Services Supervisor at Animal Humane Society. She graduated from the University of Vermont in 2013 with a Bachelor's of Art in Psychology and a Bachelor's of Science in Animal Science. While in college, she explored her love for sled dogs by working for Alaska Heli Mush on the Norris Glacier outside of Juneau. For 2 summers, she cared for and gave tours alongside her 150-plus Alaskan Husky co-workers. It's amazing. She began her animal welfare career at Animal Care Centers of New York City at the Brooklyn location, and after 2 years running shelter playgroups, she made the move to Minnesota and joined Animal Humane Society in 2017, transferring into Shelter Behavior Services in 2018. She married into a mushing family and enjoys spending winters running her family's 18 Alaskan Huskies in Grand Marais, Minnesota. Dr. Graham is the Director of Veterinary Services, Veterinary Medicine at Animal Humane Society. He is a 2004 graduate of the Texas A&M College of Veterinary Medicine. He worked in private practice at DC, Washington State, and moved to Minnesota in 2008. He has been the head veterinarian at Animal Humane Society since 2011 and helped grow the veterinary and behavior programs, including expanding vet care provided to low-cost, full-service public clinics. He is a former board member of the Board of Animal Health and served on the Best Practices Committee with AWA. He has had the privilege of previously presenting with VetGirl, HSUS, ASPCA, MAVT, and AWA on a myriad of veterinary and shelter-related topics. It's my honor to welcome the 2 of them for our Fresh Start presentation.
Hello everybody, I'm Lauren, the Shelter Behavior Services Supervisor at Animal Humane Society. If you're not familiar with Animal Humane Society, we have 3 adoption centers and 2 vet clinics down in the Twin Cities area. And we take in about 10,000 animals a year and then help thousands more through our low-cost vet centers. So that is who we are. So today we're sticking with the cat theme, and we're talking about our Fresh Start program for cats with litter box issues. So show of hands, how many of us out here have cats in their home? Oh wow, okay, wow, that's everybody almost. Keep them up. How many of you have had litter box issues with your cats? Yeah, me too, a decent amount, right? So it's a pretty common issue, and it is one of those issues that has both a medical and a behavioral component. So Dr. Graham is here. He's going to talk about the medical side of things. I'm going to talk about the behavior side of things. So what we're going to go over today is, first we're going to answer that burning question. You're probably thinking, what is a fresh start? So Graham will answer that question, then he'll move into the medical reasons we have for cats that use the litter box inappropriately. And then I will take the mic back and talk about the behavioral reasons. We will talk about how to help a cat reset in their home environment. We will talk about what happens if you get a cat surrendered to your shelter with litter box issues and what we do at Animal Humane Society. Then we're going to dig into some of the data and what the data tells us for these cats, and then we will go over takeaways and questions. We want to make this pretty conversational, so if you have a question at any point, please feel free to raise your hand and we can answer that at that point. So with that, I'm going to turn it over to Dr. Graham.
I'm going to try this and see if it works. All right, okay. I like to wander. Good afternoon, everybody. I'll do the best I can to keep energy up so we stay awake post nice lunch. I get to dig into the medical side of things, about 20-30 minutes there, and then Lauren will go through the behavior side of things, about 20-30 minutes there, kind of preparing you to think of, okay, what do we want to think about for each part of it? What we want you exposed to mainly is what are the various causes of litter box issues. You can have the exact same darn presentation, same history of inappropriate urination, and we want you to be able to think of, okay, here's the various things that can cause it, so what's going to set me up for success for being able to place this animals? So more polls of the audience, I love these. Who here takes in animals from your local community? Who here euthanizes cats, or at some point in your organization's history when you were there, euthanized cats that had litter box histories, inappropriate urination? Yep, through 2013, every cat at Animal Humane Society, any history of inappropriate urination was euthanized. And it was a lot of cats. It was something we knew we could do better. So that's where we were driven to look at how can we change, what can we do. So that's what I want to take you through is what we've learned as we've done this. It is thousands of cats we have put through this program. We have learned a lot. We've adopted cats that have done wonderfully. We've adopted cats that have not done wonderfully. So we want to share that experience with y'all. So hopefully set you up for success on that part of it. And looking at your own programs, if you have similar programs, are there things you can tweak? If you don't have programs like this, here's things you can look at of what's been successful. What's nice with the volume of animals we have coming through is we do have a large N, a lot of data that we can look at to really help support those decisions one way or another. So Fresh Start, you need like a cutesy name with any sort of program you're going to do, and what's better than, it's a Fresh Start program. It gives them a fresh start, a new home. It's good on that side of it. It really is looking at that intersection between medicine and behavior. Urinary issues can be anything on that side of it. If you once again look at the big data, and this is on the veterinary side of things, 60% of inappropriate urination issues are behavioral, but you got to eliminate those medical causes too to really get to it. It's usually a diagnosis by exclusion. So it's not a perfect 50-50, but it's close. Of what is medical, what is behavior on this side of it. There's no definitive test you can run, but for anyone that has had to navigate that behavior versus medical side of it, if you talk to any veterinary behaviorist on it, the first thing they're going to ask is, have you ruled out the medical causes? So that's why we're going to start with medical, then go to behavior for today. All right, so breaking it down, I think I just went through this. Urinary versus medical versus behavior, yep, but thinking of even urine versus feces, we actually use the same term for inappropriate defecators as well. I have one cat that a few times in her history just stares at me and makes eye contact as she's peeing outside the box at me to really let me know that she's unhappy with what I'm doing. I have another one that inappropriately defecates. She's more sneaky about it, but I know who it is. The inappropriate defecation is a whole separate thing that we will not get into today. So we're just going to focus on the urine side of things. It's the more common presentation that we're dealing with. It's actually the most common reason that cats will go into a vet clinic is inappropriate urination, urinary issues of some sort. For dogs, it's ears and skin, but for cats, it's exactly what we're talking about today. So from there, I'll wander over here, and yeah, I'll need you for putting stuff. Perfect. All right. I like to wander, as I said. So when you're dealing with breaking down medical issues associated with inappropriate urination, just what you see in front of you in the cat really helps hone you in on what you're looking at. Age of cat, species, of course it's cat, sterilization status. What you're dealing with in front of you, what you see, is what lets you know what should I be looking for. Age is actually really important. Who here has had a cat that has had some bloody urine, inappropriate urination issues, just home, personal cat? Gone to the vet for it. Non-veterinarians in the room. What did you think you were going to come home with? What did you think you were dealing with in those situations?
Infections and stones.
And I heard infections, I hear stones, anything else? Stress, I love it. Infection is what you see most common from the public. We're a very nuanced and more learned group on this side of things, since better answers on that part of it. But most people going in think they're dealing with a classic urinary tract infection, just like people would show from a middle-aged human on that side of it. You get some antibiotics, and then you're fine afterwards. The studies done of younger, under 9, 10 years old cats, non-kittens, over 6 months old, maybe over 12 months old, shows the likelihood of an infection in those cats is at the level or less than stones, tumors, and other things. By far, stress is the most likely cause of what you're dealing with. So just your presentation of what you have in front of you really can designate you in of what you think you're dealing with. Age-wise, if they're really, really young, or they are older, they are more likely to have bacteriuria, have bacteria in their urine, sometimes even having a clinical infection associated with it. Just like we talked about this morning, you can have fungus there, and it's not always an actual ringworm infection. You can have bacteria there, and it's not always a bacterial infection that's causing your clinical signs. So that's something to make sure you're taking into account working with your veterinarian, usually if you're getting to this level of nuance associated with it. But if you've got a really young kitten, or you have an older cat and you're seeing inappropriate urination, yep, infection should be on your list. If it's middle age, if it is a few years old, not getting up to double digits, it should still be on your list, it's possible, but is actually least likely. of the more common things you see out there of what's going to cause those problems. If you throw antibiotics at it, it's going to get better, and that's why we'll get to some things later on that part of it of why. But it's something that's usually not an infection. So age, you look at where they're sitting on that part of it. Species, they're cats, I don't know why I put that up there. And then sterilization status. You're dealing with animals peeing outside the box. If we have, for our Fresh Start program, this is stealing a little bit of Lauren's behavior thunder later, if they're peeing outside the box and they're an intact boy, we're just going to fix them. They like to mark, they like to spray. Intact females, you can see it some as well, but if they're still intact, there's a whole nother level of worry from what hormones are doing, especially the scents you have around in your house or especially in the shelter. So that's where we'll look at sterilization status to make a decision. All right, history. Anytime you're working up a medical case, anytime you're working up a behavior case, history is crucial. It's what you absolutely need to know. You can see what you see in shelter, see what you see in your organization, in your foster home. That's just a point in time, but you always need to get a good history. The generic questions I have up here are the generic questions, not just for urinary issues. This is the classic questions they teach us in vet school that you ask to make sure you're getting as good of a thorough history as you can. If you can answer these questions associated with it, you're going to know as much functional history as you can. Thinking of basically, when did things get started, where are they now, how did it progress from then to now, and then what sort of meds, what have I tried, what have I thrown at this? Be it behavior modification, be it antibiotics, things along those lines. If you look at your own intake forms, you look at your own histories you take, if you can answer these questions, then you're doing a pretty good job. And you can always dig in and dive in. That's where I will ask this behavior team from Animal Humane Society sitting at the front table here, or Lauren as well. What are the specific nuanced questions I need beyond that? Leaning on my behavior experts when it comes to there. But if you can generally go from how did something start, how did it progress, where we're at now, it's going to let you know a lot. Thinking of your, classic, let's say a bladder stone type cat. That is something that's usually going to be slowly progressive over time as you have something developing, maybe intermittent blood, intermittent difficulty urinating, but it's something that's usually going to be a chronic issue building up over a long period of time, always getting worse, as opposed to some things that might be based on behavior of cats outside, that might be seasonal or based on the weather or kind of intermittent come and go, but usually not getting worse. And then what have you tried? What have you thrown at this situation, and did you see any improvement or change? So history in these situations are crucial. Initial evaluation, what we do for every cat that we're worried about for inappropriate urination is simply just check a quick urinalysis. Lets us rule in around a lot of things, but just starting with your physical exam, checking an animal out. We already had the question earlier. I didn't get to look back and see who answered. So who does an initial evaluation on every animal coming in your shelter or rescue right away? Yeah, most hands in there. Pretty good. Who has a veterinarian do that initial evaluation? Didn't think so. Who has a technician or someone trained to do that evaluation? Yep, same thing. I got a ton of vets in shelter, need more in the clinic, and we do not have the resources for a vet to do every evaluation on that part of it. You can still do a really good evaluation. It's practice, and it's recognizing what's abnormal. So thinking of that physical exam, I really just make sure that I am grossly looking at wherever genitalia we need to make sure that there's not something physically there. I've definitely gone down rabbit holes of bloody urine, ends up being a tumor sitting in the vulva or something along those lines that I missed. And then making sure you get just a decent feel on the belly. If we've all been dealing with cats, we know what a blocked tomcat feels like, where you've got this big, full bladder. If you have inflammatory issues in the bladder where it's really irritated, usually it'll be pretty small, but kind of a firm bladder. And then if you got stones, sometimes you can feel them even crunching under your fingers, and it's really kind of disconcerting, and you call over your friend to feel, because you don't get to feel it very often, and it kind of feels cool. You can actually pick up a lot from the physical exam. It can point you which way you're dealing with on these urinary issues. Urine screening, we make sure we collect a urine sample if we can. I hate those beads you put in the litter box because the cats hate it as well too and hate to pee in it. Sometimes it's the only option you get to get a urine sample. Who here does cystocentesis? Who will grab and poke? I love how many hands are going up. It is so good to do, especially on cats, because you can feel the bladder and you can poke it. You don't need a veterinarian to do it. You want to make sure a vet or someone's training to feel competent and good at doing it, but it's a really good way to get a sample right away and get an answer as quickly as you can to get that cat to the right outcome. And then looking at the screening, if there is a ton of bacteria, great. We found an infection, something we can treat. Crystals don't always mean that you're dealing with a stone, but if you see a lot of crystals sitting in the urine, it can tell you one thing. How concentrated or dilute the urine is can let you know if there's organ disease you're dealing with. If you get that really clear looking urine, but it's really concentrated, it's probably going to have sugar in there and it's a diabetic that you're dealing with. You can get a lot from a urine sample, and just from doing the little specific gravity dipstick in-house can really point you in a good direction. What you're going to see most of the time is reasonably well concentrated with some blood and kind of scratching your head to figure out what you're dealing with. You don't always get an answer, but it can really point you the right way. And then the final thing that we make sure we do is look at observation at shelter. Our criteria for the behavior part of our Fresh Start program is if medical is completely covered and taken care of, they still need to use a litter box in shelter. They still need to show they can use a litter box. You get some cats that have either just lived outside, had some aversion to litter box that just won't use a litter box. That is one of the criteria we make sure they do, so we make sure we observe them in shelter that they will use a litter box. And it doesn't keep us from, we'll throw them in a colony room, see if they go, have to check around the colony room. Usually these guys have to dig around the colony room to find out if there's stray pee anywhere. I don't know if you use black light for those, but you can smell it. So initial evaluation is usually where we'll go on that side of it, of looking physically. Once again, can let you know a lot of things to figure out what you're dealing with. All right, advanced diagnostics. So, scratching my head, I don't know what I'm dealing with, I'm still a little confused. There always are further steps you can do for diagnostics. If you are not doing these, you are not failing by any means. These are advanced things that it's nice to have access to. They are not musts.